Hello, I'm Dr. Rothman of LASIK of Nevada. I wanted to answer a question that's kind of fundamental to the whole idea of laser vision correction, which is what procedures are available to correct my vision and how do they differ? So today there's really two major procedures that correct vision with lasers. One is called LASIK, and that's the more common one. That's the one with the little flap. And then the other procedure is called PRK. Interestingly, PRK was actually the first procedure to be approved in the United States for laser vision correction, and I was very, very fortunate to be part of a practice in 1995 that was literally doing these procedures on the very first day the FDA approved them. That was actually when I made the decision to devote my career to laser vision correction because I was so impressed by the results. So what is PRK? Well, PRK is basically a laser reshaping the cornea or surface of the eye in such a way that the image focuses clearly on the back of the eye. Technically, what we do is we actually use a gentle chemical to soften the surface layer of tissue and just move it aside, exposing the area underneath, which can be reshaped by the laser, and then just putting a contact lens over that open surface while it heals. Now, the good news is that tissue is the fastest healing tissue in the body and usually heals within 3 or 4 days. If you're 18, it might be 2 or 3 days. And then once the surface heals, that new shape is translated to the front surface of the eye, thereby improving your vision. So PRK was the first laser vision correction procedure that was approved in the United States, and still to this day, every single surgery day I do procedures, I'm almost always doing at least one and sometimes as many as 2 or 3 PRKs for various reasons. That's the first procedure that was approved for laser vision correction. LASIK is actually the newer procedure, although LASIK was approved in the 90s as well. I started doing LASIK in, I believe it was 97 or 96. And what LASIK is basically the same exact reshaping of the tissue underneath the surface, but just using a different way to get to that tissue in a way that involves quicker healing. And that's why LASIK has become the most successful elective procedure in the history of medicine, because it's so safe and so effective, and in less than 1 minute per eye, you could be rid of a lifetime of glasses or contact lens wear. So the way that procedure works is we have 2 lasers, one that does the reshaping, as I mentioned earlier, and that reshaping is the same for LASIK or PRK, and it's actually treating the exact same tissue with the exact same laser. With LASIK, we have a second laser that actually creates a gentle separation at a slightly lower than surface level, so that we can move a little bit of tissue off to the side, reshape, and then slide that tissue back into position. The beautiful thing about LASIK is that that flap, as we call it, literally sticks in place like magic, almost instantaneously due to capillary attraction. And by the next morning, the little opening around the edge of the flap, in most cases, has sealed completely. So LASIK is a very much the same idea as PRK, except advanced to allow for quicker healing. Now, people often ask me which of these 2 procedures I like better. And the true answer is I have 2 kids and I love them both the same, but they're different. And PRK and LASIK are just like that. They both take you from where you are now, being dependent on glasses or contacts, to a place where you're no longer dependent on glasses or contacts, but LASIK is a more immediate and direct path. PRK requires a little more healing and a little more remodeling afterwards. But again, both procedures are safe and effective, and we do both procedures regularly, depending on what your particular needs are. So I invite you to come in for a consultation to find out if you're a good candidate for LASIK or PRK, and I look forward to meeting you at that time. Again, thank you so much for listening, and I look forward to meeting you soon.